If you've been wondering, how do I get off diabetes meds? Or maybe you're so sick of taking them that you've already started skipping doses without a plan. This video is for you because the truth is you absolutely can get off type 2 diabetes medications. But if you do it wrong, you'll wreck your blood sugar and your energy and possibly even your sex life. If your goal is to no longer be diabetic and instead be fit, be strong, be healthy, this video is your step-by-step roadmap. No BS, just strategy, physiology, and a clear exit plan from medications. Most men I work with don't want to be on meds forever. So, something I hear often is that they wouldn't even take Tylenol before, and now all of a sudden they're taking this just cocktail of pills every morning and afternoon, and they're sick of it. And I don't blame them. It sounds terrible. They hate the side effects, they hate the dependency, and then deep down, they hate the idea that they're sick, that something's broken, and all the meds do is just mask the symptoms, that they don't reverse the cause of the diabetes in the first place. Now, here's something I look for with every guy I talk to. If you're not taking your meds consistently, so if you're skipping them, if you're forgetting them when you go on vacation, or if you're trying to wean yourself off without telling anyone, that tells me one thing loud and clear. You don't trust the plan. And if you don't trust the plan, that's either because A, you don't trust your doctor, or B, you think you can handle this with diet and lifestyle instead of the medications. And you know what? That's fair. Because if that's the case, then pick a path and commit to it. Because the guys who stay stuck the longest, they try to live in both worlds, saying they'll eat better, but still they drink beer, they eat potatoes, they graze all day long, they eat bread. And then they have to restart the medications because their doctor lectures them about how their blood sugar, their blood work is getting worse. So that's not diet and lifestyle as medicine. That's just denial. And it's going to make your diabetes and ultimately your symptoms worse in the long run. Now, I work with men every single day using diet and exercise as the main tool to reverse this disease. It's super effective, really at any point after diagnosis. But if you've been on diabetes medications for years, it needs to be done in conjunction with tapering off these drugs, not quitting cold turkey. And if you were warned that you might need diabetes meds soon, let that be a lesson because once you start them, it's really difficult to stop because you become dependent. That's your main tool. Now, let's talk consequences of stopping these meds too soon. So if you pull the plug on medications before your metabolism is ready, you're playing with fire. And that's because you risk your blood sugar staying high, chronically high. And that leads to brain fog and nerve damage and liver overload. And then, vision changes. And for men, it means low testosterone and erectile dysfunction. Yes, we're going there because I see it happen often. Uncontrolled type 2 diabetes is just this slow decay. And by the time you feel it, chances are some damage is likely already locked in. So let me be super clear here. Treatment isn't about natural versus pharmaceutical. It's about treatment. This is about outcomes. You want to get off the meds. That's awesome. That conviction and clarity is a key place to start, but do it the right way. You need data on your side. So your first mission is to get your A1C under 7%. That's the line where most doctors say that you're stable. It means the diabetes is controlled, which suggests there will be less damage in the long run to your organs. But if you're motivated to optimize your health and your energy and your body composition, let me give you the real goal. Got to get your A1C under 5.7%. That's the threshold for no longer being classified as diabetic or pre-diabetic. Now, here's where I want to address a common pushback. A lot of people say, well, isn't 5.7% a bit aggressive? Well, yes and no. If you've had diabetes for 10 years or longer and your body's been insulin resistant for decades, then yes, it might take longer and we don't expect you to hit that goal overnight. But if you were diagnosed within the last couple of years and you've still got decent beta cell function in your pancreas and you want to live a long, enjoyable life, then aiming for 5.7% is not only doable, it's strategic. And yeah, to be honest, I am going to be more aggressive here and push you to excellence because I'm guessing your doctor wasn't. That's pretty rare. The lower your A1C safely, the better your outcomes are across the board. So lower complications with the biggest risk factors for having type 2 diabetes. So low risk of ED and stroke, better insulin sensitivity. So you can eat pasta again someday. But again, lowering A1C isn't the goal by itself. Lowering it because you fix the root problem, that's the win. So here's the game plan. This is what I coach every client through, before we even talk about touching their meds. Step one, track like a hawk because you're not guessing your way through this. So get a CGM if you can, and at a minimum, track fasting glucose every morning and your daily average blood sugar level. And then log your meals, log your movement, your stress, your sleep, your glucose response to meals. So 90 minutes after that first bite. Because you're not just a patient anymore when you decide to reverse this disease. You're a data analyst. Yes, it's time consuming, but it's also eye opening. Step two, fix the root cause of the disease. This might be news to you, but type 2 diabetes isn't a blood sugar problem. It's an insulin resistance problem, specifically insulin resistance in the muscle, the fat, and liver tissue. And that means that big picture, the goal is to increase insulin sensitivity. And we fix it through strength training 3 times a week, walking after meals, protein forward meals, lowering total carb load, at least temporarily, sleeping 7+ hours a night, and then managing cortisol. And this creates metabolic demand. And that demand is what drives change long term. Step three, it's time to layer in metabolic stressors. So if you want faster progress, that's good, but you have to earn it. Healthy stressors include cold exposure, so ice baths, cold showers, cold river plunges, intermittent fasting, so you can skip breakfast, you can delay the insulin spike, rucking or some sort of inclined walking on hills, and then progressive overload with strength training. So these stressors build resilience. They also improve insulin sensitivity. And then lastly, step four, you have to work with your doctor. So don't work around them. This is crucial. And I feel like I don't need to tell you this, but never wean off meds without talking to the person who prescribed it in the first place. Otherwise, you get stuck. That means ideally, you want a doctor who gets the reversal process, someone who isn't just managing decline, but helping you build back your health, because it's a totally different strategy. We typically taper meds after several weeks, sometimes even months of stable, improved data. We start with the lowest risk meds first, things like Metformin, and keep an eye on glucose levels and low blood sugar risk, and then lab work every 6 to 8 weeks. This is a little harsh, but if your doctor won't work with you to do that, then you have to find one who will, because meds aren't the enemy, big picture. Misuse and poor strategy is the enemy. So when do you know when it's time to taper? Well, here's a couple rules that I go by. Number one is 3 to 4 weeks of fasting glucose levels consistently under 110, and ideally under 100. And then a CGM average under 120. The third rule, A1C below 7% and trending downward. And then the fourth thing is that you're training regularly, you're walking daily, and sleeping at least 7 hours. That's when it's time to have a conversation about the meds. And here's a critical addition to that. If you're consistently getting low blood sugar episodes, so under 70, and they're confirmed with a finger stick, that's a sign that you're probably over-medicated. And that's not a badge of honor at that point. That's a warning light. Again, you got to talk to your doctor and adjust strategically. All right, now let's run through some common objections I hear and how to think about them. The first one is that my doctor said diabetes is progressive. I'll always need meds. Well, that is the default narrative because most patients never change their behavior. So there's an assumption that no one will, but that's not a death sentence. We have study after study showing that reversal is possible. The direct trial, the Verta Health study, studies using prolonged fasting with Dr. Jason Fung, bariatric surgery studies. They all show that diabetes is reversible. And we have loads of anecdotal evidence of real world people changing their A1C, their body composition, their insulin levels. So if your doctor has never seen reversal, that doesn't mean it can't happen. It means, well, it probably means they're not looking for it. The next question I hear often is, well, metformin isn't that bad, so why stop it? It's a valid question, especially because metformin is associated with longevity. It's a tool and it's cheap. It's typically well tolerated in general. I'm not demonizing it, but ultimately it's up to you. Do you want to be dependent on a medication for the rest of your life? For me, I wouldn't, but that's a personal decision. Big picture, if you don't want to be on it forever, then you need to replace it with something stronger. We're talking walking after meals, consistent resistance training, hitting your macros with zero wiggle room. Otherwise, the hard truth is that you're better off staying on it. Okay, last objection that I hear often is that I'll just fix this with food instead of these meds. And look, that's fine. Personally, that's my hope for you. But only if you mean it and can commit to it. Don't say that and then keep drinking beer and ordering French fries and then, eating cereal after 10 o'clock. That's not food is medicine. That's food is fantasy. So you're either treating this with intentional input or you're making it worse. Here's the part nobody talks about. Getting off meds, that's difficult, but it's doable. Staying off meds, that requires a full-blown identity change. You can't just fix your numbers. You have to fix your mindset here. You become someone who trains with purpose and eats like their energy depends on it, because it does. You also want to sleep like a performance athlete. And you need to be somebody who's open to experimenting, tracking, learning, adjusting. And then you need to be someone who rarely, if ever, drifts back into that old pattern. What I've learned is that reversal isn't just physiological, it's psychological. This can't be a phase, it's a new operating system. But when you own that, you don't need pills, you don't need guesswork. You've got a plan and it works. You just need to be super consistent. So if you're serious about getting off diabetes meds, here's your next move. Check your A1C. Is it under 7%? That's great. Under 6%, better. Under 5.7%, game on. Number 2, start tracking your glucose daily. Know your numbers before you make any changes to your medications. Number 3, train your body to become insulin sensitive. Lift, walk, sleep, eat smart. And then number 4, work with someone who knows how to reverse the disease, not just manage it. All right, subscribe for weekly videos on men's metabolic health. Take care.